Your DOT medical certificate has an expiration date on it. When that date passes, you are no longer legally certified to operate a commercial motor vehicle, not until you recertify. It doesn't matter how long you've been driving or how good you feel. The clock runs whether you're watching it or not. So how often do you actually need to get recertified? The standard answer from the FMCSA is every 2 years. That's the maximum certification period for a driver who meets all the medical standards without any conditions that need closer monitoring. 2 years, and then you come back in. But here's the part a lot of drivers don't hear clearly. That 2-year period is a ceiling, not a guarantee. A certified DOT medical examiner can issue your certificate for a shorter window based on what they find. We're talking 3 months, 6 months, 1 year. Whatever interval makes clinical sense for your situation. That's not a punishment. That's the examiner doing their job, keeping an eye on something that warrants attention. The conditions that most often lead to a shortened certification period are things like high blood pressure, type 2 diabetes, sleep apnea, certain heart conditions, and borderline vision or hearing findings. If you're managing one of these, that doesn't end your career. Plenty of CDL drivers with chronic conditions stay on the road for decades. The key is consistent management and keeping your DOT examiner in the loop. One thing that trips drivers up is confusing CDL renewal with medical certificate renewal. These are two separate processes. Your CDL comes from your state DMV. Your medical certificate comes from FMCSA regulations and has to stay current on its own schedule. In many states, if your medical certificate lapses, your CDL gets downgraded to a non-commercial license automatically. That's the kind of surprise you do not want. Tracking your own expiration date is on you. Don't assume your employer is watching. Set a reminder at least 60 to 90 days out so you have time to schedule and room to handle any follow-up testing if the examiner needs more information before issuing your certificate. Blood work, specialist records, extra documentation. These things take time. Don't cut it close. When you do come in, bring your current medication list, any records for ongoing conditions, your glasses or contacts if you use them, and hearing aids if applicable. Being straightforward with your examiner moves things along. They're not trying to pull you off the road. They're trying to make sure you can stay on it safely. If you're in the Central Valley and need to schedule, you can book at .modesto.com.